as far as mitigating symptoms and just helping patient outcome overall, how did the insulin pump approach compare to the oral? What were some of the things that you found that maybe were a little different or prevented with the patient outcomes through the pump?
Yeah, so very good question. So, a few things there. So, first, in the people that are taking kind of the oral glucocorticoids, what tends to happen is you get these early peaks of cortisol activity after you take the dose. But then after a few hours, the medication basically disappears. And a lot of things that we've noticed with our patients are one, starting the day is incredibly hard. And so they'll say getting up, getting out of bed, very difficult. Sometimes they'll have some nausea, they'll feel lightheaded, they'll feel dizzy in the morning. And that's really because that dose they took the afternoon before is completely gone. So in the interim, you can have people take the medication 3 times a day, sometimes even more than that, which can be a challenge, but you're still ending up with the same issues where it really disappears overnight. Those levels are essentially zero in the morning, and people can have a lot of struggle. They can have struggles later in the day as well. So by using this insulin pump and by having some overnight cortisol being delivered, incredibly effective, by also adjusting the dosing so that they can give themselves additional boluses throughout the day as needed. It really kind of mimics the normal physiology. We found that helpful. And if you ask kind of what are some of those symptoms that get mitigated, really it's a lot of the same things that we see in ordinary people that have adrenal insufficiency. So like the headaches, the nausea, the dizziness, the lightheadedness, the energy. Those are the big things that really tend to improve with this.
So when you were doing this work, what governed which patients that you selected for this cohort, and how can that be applied to see what patients with adrenal insufficiency would benefit the most from this insulin pump approach?
Yeah, so that's something we really need to get better grasp of, like who exactly would benefit from this modality, right? Because the vast majority of people, they do fantastic with the oral steroids. It's really kind of the subset of people that don't, right? And so we don't really understand what makes these people different. The fact that they just don't do as well symptomatically by taking oral hydrocortisone or another oral steroid. But generally, the people that we switch over, they have a few kind of criteria. One is that they remain symptomatic and a lot of the same adrenal insufficiency symptoms that they had initially. Sometimes they'll get a little bit better, sometimes not all the way better. But what we see is that despite being on the oral steroids, despite being on it like 3 times a day, taking it very consistently, they remain persistently symptomatic. So if that's the case, that's someone that we really look at in terms of first making sure that we're not missing another etiology, like for example depression, sleep apnea, a thyroid issue, anemia, other kind of things that can also contribute to like low energy, mood changes that look like adrenal insufficiency. But then other kind of people are people that are getting in and out of the hospital that are having adrenal crises, people that we can't really rely on their gut to absorb the medication. So people that have malabsorption issues or motility issues with the colon, people that do shift work, and so they're kind of flipping from days to nights, where it makes it really hard to kind of manage them with oral therapy as well. So those are some of the other kind of groups that we might think about using the pump in.
Interesting. Yeah, I was thinking a bit about that kind of lifestyle thing, and also some of the social determinants of health, maybe people who have less familial support or kind of like a support system to keep them.